you very much, Dr. Kittleson. I did not want to miss this, and I know we are all in for a treat because Jeffrey Patrick, who is one of our most recent alumni, is certainly very distinguished. And those of you who know him know he is multifaceted, multi-talented, and also a great speaker and presenter. So without further ado, I am looking forward to his introduction and to his talk. In order to not distract, I'm going to mute, and I ask everybody else to mute who's not going to be speaking. So thank you very much, Jeffrey. Welcome back to your school.
Thank you, Dean Ambler. Thanks for mentioning, yeah, if you could just mute yourself, that'd be fine. If you want to keep video on, that's also fine. I'll probably disable my video just to allow the bandwidth. Just a quick comment. You know, we never would thought we'd have to say this, but should we be bombed, Zoom bombed, we will end the meeting immediately. If you could wait a minute, log back in. Because we'll get rid of the bombers at that time. So appreciate that. Again, I appreciate if you could mute yourself during this time period. I'd really like to introduce Jeffrey Patrick. He's a graduate of last May, Health Policy and Management. I've known Jeffrey, I've been here since spring of 2018. I think, Jeffrey, I think I met you few weeks after I came in here, and I've got a little story to talk to you about that. But Jeffrey recently has been hired as a public health advisor for the New York City Health and Hospitals as kind of a contact tracer, kind of a supervisor for contact tracer. And we'll talk a little bit about that. And I think it's really important because it's becoming a critical role in the U.S. And I think Jeffrey's on the forefront of leadership in many ways. He also has an appointment with the New York Medical College over in the School of Medicine. So I know that he is very interested in dealing with preparing healthcare providers in many areas of health. My experience with Jeffrey, if you know Jeffrey, I don't think I've ever seen him upset. I mean, I've never seen him sad. I've seen him sometimes upset, but he always has a smile on his face, and he is very energetic. And as you know, there is a National Public Health Week that is hosted the first week or so in April, and we have had, nice presentations done, but it's always a struggle trying to organize this. And several months prior to 2019, Jeffrey offered to organize this. I said, well, that's great. Not only did he organize it extremely well, he also received funding for it. He was able to recruit and get people to give some resources to help this. So he has this great ability to be able to talk to people and get the best out of them. So Jeffrey, with that in mind, I'm going to turn it over to you. He doesn't have a PowerPoint, but that's okay. And we are recording this, and so hopefully there'll be times for questions. If you want to send a question via chat, I can oversee it, and then toward the end, I can always I can ask him that as well. So Jeffrey, thanks for doing this. We're looking forward to it.
I appreciate it. Thank you very much. And I do have a PowerPoint here. I was just kidding. Hold on one second. Let me pull it up. Can you guys see my screen? And if you could read the screen here, this is my philosophy through academia and through, it says, never forget that intelligence rules the world and ignorance carries the burden. Therefore, remove yourself as far as possible from ignorance and seek as far as possible to be intelligent. Marcus Garvey, all right? Let me pull it up. Okay. All right, so can everyone see my screen there? All right, thank you so much, Dr. Kittleson, for the introduction. I greatly appreciate this chance to share with everyone about what's happening and taking place. And also, Dr. Amler, I really appreciated Dr. Amler and all the times that I bothered I bothered you, and I was a rat. Don't bother Dr. Amler, okay? He's a busy man. Let it be known. But let's get the show started. All right. So there are no disclosures here, and we're going to move forward. Now, the agenda. We're going to introduce you to the contact tracing and what's going on with it. I'm going to take you through the standard operating procedures. We're going to take a closer look at the COVID-19 measures in New York City, because that's where we're doing most of our work. And why is testing important? We're going to take a closer look at the program itself to show you what's really happening and what we're doing and how diligently we're working to make sure that New Yorkers are kept safe. And we will take you to the safeties first closing. Now, introduction. One thing that I want everyone to remember before we leave here, that you must understand that we are trying to avoid
I see him,
COVID-19.
Deja. I can't see.
Can you guys mute? Thank you. What we're trying to do is we are trying to avoid COVID-19. And the core 4 is what we must really pay attention to. And they go as following. Number 1, you wash your hands, right? You make sure you wash your hands. This one is a given because it is the first step in defense against all viruses. We're going to make sure that we wash our hands thoroughly. You're going to wear your mask. I think not wearing your mask is probably one of the most inconsiderate things that you can do, especially getting to know what I know now about what's taking place in our city. We have to wear our mask. Number 3, stay away, right? We're going to social and we're going to physical distance ourselves. It helps us remain together, right? As much as you want to be together, trust me, this is the time for us to make sure that we're following those guidelines. Social distancing and physical distancing is a must. Number 4, please stay at home. Stay home. If you're not feeling well, do not go out there unless you're going to seek medical attention. Those are the 4 things that everything is going to be circulating around these 4 things. These 4 things are the core 4, and it's preached at the Test and Trace Corp in New York City Health and Hospital. So we're going to make sure we pay attention to those, and it's going to be our core. Washing your hands. See, this is the thing. Washing your hands correctly. This is one of the things I like. When I first got the job, I started in June. I was one of the first contact tracers, community engagement specialists that they hired. We had to learn, you have to wash your hands correctly and sing happy birthday to yourself. And that will be the time you need to spend to wash your hands, interlocking your fingers, dorosum, and you're going to interlace your fingers. You're going to make sure you cup them, get underneath your fingernails, wash your thumb. This is the busiest one. You want to make sure you keep those clean, right? And you're going to scrub your palms. You're going to make sure your hands are clean. It is important. It sounds a little redundant, but trust me, it is the first step. Mask wearing. You have to wear your mask. This is what I think is the most important thing about wearing your mask. A COVID carrier and contagion probability, 70% if you're wearing it and you're not the carrier. If the carrier is wearing it, the contagion probability is 5%. But if the both is wearing it, it's 1.5%. That's why it's so important for us to wear our mask. Social and physical distancing. I don't know if anyone had taken a look at this experiment right here. The invisible black ink. See, what you're seeing right there is what's shown underneath the black light of how a disease can probably spread. And look at it. What they did is they put one person with the black ink and they send them into the location, and they serve themselves, and they're in there having a good time. And look how the black ink has spread. Look at that guy's face, how he's glowing, and he's not the one with the ink. So I think that's something that we should really, really consider when we're talking about social distancing and physical distancing. Yesterday, as of yesterday, right? As of yesterday, do you see what the headline says? As of yesterday, nearly half of 83 people who attended Ohio wedding test positive for COVID-19. And the newlyweds and their grandparents were ones who were actually contacted by the disease. Well, it says, I don't think that almost half of our wedding guests were gonna get sick, Michaela Bishop told the station. You're in the moment, you're having fun, and you don't think about COVID anymore, which I think is a terrible mistake. It's spreading it. It's spreading it. And then remember, we're gonna want to, if you're not feeling well, you're gonna want to stay home. You're gonna want to stay put. You're gonna, if you're going out, you're gonna wear your mask, but staying home is gonna help to remove the infection from the environment. And that is something I think we really want to make sure that we're doing. Now, let's get into some definitions of contact tracing. Contact tracing is a standard public health tool used for many decades to control the spread of many infectious disease, where you got to put on your detective hat. That's one of the things I really, really like about this job, is that no day is the same. And you really get to see some different things going on out there. And for those who were in epidemiology, Dr. Drugi would just be like, what? You didn't mention Jon Snow, the first detective in public health epidemiology? So yes, we have to be like Jon Snow. Not Jon Snow from Game of Thrones, but Jon Snow, the doctor who was the one to find out why cholera was ravishing London, right? So here are what we're going to be investigating. These are the key points. First, we're going to be investigating the cases. The cases are the people who have actually tested positive. The Department of Health sends them over, and we take that information, and the case investigators and the community engagement specialists, we're going for the case investigation. Then we're going to look for the close contacts. Close contacts is anyone who's been within 6 minutes, within 6 feet and 10 minutes. So more than 6, less than 10. The CDC actually says 6 feet, 15 minutes, but the Department of Health in New York City says it's 10 minutes. We're going 10 minutes. And we're going to make sure we find those close contacts, because the close contacts are probably the ones that's going to be more likely to have been infected. Then the non-close contacts, right? These are the people that they don't fall into the 610 category, right? So we still want to catch those, because one of the things that I've noticed since I've been doing this job is that non-close contacts are also coming down with the sickness. They're also testing positive for COVID-19. So we want to pay attention to them too. And the contacts to the second degree. The contact to the second degree is the contact of the close contact. So the person who has been a close contact, their contacts are someone we really want to take a look at. And this is where the job gets a little bit, I want to say, it gets a little difficult, because you want to make sure you find those people, because they could be spreading it without even knowing it, especially if they're asymptomatic. And then you got the proximity people, right? The proximity people are interesting, because just think for a second. You're at some sort of function, or something's going on, and the person who has COVID is all the way on the other side of the room, and you're not in that 6-10 minutes, but you guys did go up at the same time to get a drink of coffee, and his coffee cup and your coffee cup never meet, but you both use the same tap to get the coffee, or you both went to the bathroom at the same time. So the proximity people also play a very interesting role in what's going on. And at every one of these points, right, we want to ensure testing. Testing is absolutely important, and testing it is the key, as we will see later on. So cases are isolated and the contacts are quarantined. That's what we got to remember. So isolation for the positive people, quarantine for the close contacts and everybody else. Now, the name of the virus or the pathogen that caused COVID-19 is the SARS-CoV-2, and that is the novel coronavirus that's in the system. This is it. Now, I'm a COVID-19 survivor, right? And that thing had me. Okay, so let's rewind it here for a second. The night before I got sick, right? I said to myself, man, I'm glad I'm not going outside because there's no way that I can catch it if I go outside. But unbeknownst to me, my wife works in a nursing home and she was asymptomatic. So the next morning I woke up with 104 fever. I was like, what is going on? Isolated myself, and I'm telling you, it was a week and a half of pure misery. It felt like I was getting hit in my back, in my lower back, with a sledgehammer over and over. And I had to like really not let my wife know that I was in such a dilemma, because I didn't want anybody to start worrying. But I did isolate myself. I was in my office. I slept on my couch pulls out into an office bed. And so I know this is one of the reasons why I even got involved with this Test and Trace Corp, is because I've actually been through this feeling, and it is something that I am telling you I never want to live through ever again. And more importantly, I didn't want anyone else to actually go through this, and I wanted to do the best I could to make sure that I do what I can to stop this virus, right? Okay. So, New York City Test and Trace Corp. We got the key positions on the front line. So our job is to intake. We're going to take these people and we're going to bring them through the system. We're going to make sure that everyone gets back to being whole. First are the case investigators. The case investigators are the ones who are initially reaching out to all that who have tested positive and looking to bring those in to the system. We want to make sure that the close contacts are also considered thoroughly, and they're moved to the community engagement specialist. Now, the community engagement specialist is what I really do. I'm a public health advisor level 2. So what that means is whenever there is a hiccup between the case investigator and the case, that means they can't be reached by phone. They can't, the intake process was not completed. Somebody's a child. If somebody's living some kind of a congruent living, whether it's a jail or well, not hospital, but, home shelters or something like that, they have to send the community engagement specialists out into the field to make sure that we get in contact with these people as soon as possible. Now, I'm not even gonna lie. When I first took this job, I was a bit nervous. I was nervous, and I was saying, man, but from my background, I used to wrestle. My wrestling coach used to say, bravery is knowing the danger, but still going anyway to make sure that everyone is safe. That's what bravery is. So I braved up myself and I went forward, and we are now doing some miraculous work with the community in New York City. Now, the case monitors, we also monitor too. As a matter of fact, I had 2 monitors this morning. I'm still at work. I tried to get off today, but they were like, no way. As a matter of fact, I only work 4 days a week. Now they're trying to push me to 5 because things are starting to pick up a little bit. So the case monitors, they monitor the cases, right? They monitor cases. So the case itself are monitored for 10 days, and then the close contacts and everybody else, they're monitored for 14 days while they're in quarantine. So that means we call them every day to make sure they're okay. I was monitoring someone, and they were on their 11th day of getting out of quarantine, and they started to get sick. She started to feel a little fever and headache, and that's why it's very important for us to monitor what's going on and make sure that we try our best to keep a cap on what this virus can do. It is a serious thing. It's a serious thing. It has the potential. It has the potential to take your life. And one of the things that really bothers me or irks me is when both on the left and both on the right, they talk about these numbers like it's not someone's beloved grandmother or some grandparent or somebody's mother. There are people on the other ends of those numbers, and we should really take that into account because that is what really matters. The people are there. And one of the things I really love about the Test and Trace Corp is that the navigation system that's in place. Now, listen to this. The navigators, right? The navigators are super important because what the navigators do, they provide wraparound services for those people who are in the system. Wraparound service are hotels, because I had a lady the other day, she lived by herself. She was 82 years old, and there's no way I could let her stay by herself because, I was probably the only person she spoke to in a while, and who knows how she got the virus. But the wraparound service made sure she got a hotel, make sure she had food, make sure she had medication. And we even partnered with AT&T to provide cell phones for people who don't have cell phones so they can remain in contact with anyone they need to be in contact with, including, health professionals and family. And one of the things that I think is remarkable is that shows how much we care and how much we're really looking to go forward with making sure that each New Yorker are set when they're dealing with COVID-19, right? And another thing, right, is this. Yeah, if you don't have it, I suggest you get it. The proximity app, right? The proximity app does a very important thing. What it does is it lets you know if you've been in contact with someone for more than 10 minutes and longer than 6 feet, or you know what I mean, 6'10", more than 6, less than 10. So it gives you a signal to let you know if you've been in an area with someone. It doesn't give you any medical information. It just lets you know that has happened and you should get tested, because once again, testing is super important. Testing is it should be really 5 core things, with testing being the 5th, but we'll get to that. Okay, so we want to define the time. This is when you're tracing and you're doing community engagement, you want to make sure you realize the incubation period, right? You want to know the infectious period. You want to know what's going on with every single person you come in contact with. Now, the incubation period is the time when someone is affected until their symptoms develop. This is very interesting. Like the lady who started to get sick on the 11th day. It's an average, they say, of 5 days, but I think the 14 days is short if you ask me, but I'm not in charge of that. Now, someone with COVID-19 is contagious 2 days before they start showing symptoms. Now, that's important for you to start calculating what's going on, because 2 days ago, someone could have been at choir rehearsal, right? You're at choir rehearsal. Now we got to go look at the whole choir. They were somewhere else, and we got to go back to those 2 days. And the infectious period is the time during which people are infected with with the coronavirus, and they're infecting each other, right? Okay, so priority. You're getting ready to go on the road. Contact tracers, we stay on the road, right? We're there. Yes, we make phone calls, but we're there, and you have to prioritize. This morning, I had 2 case investigation and I had 2 monitoring. So I had to go out and I had to case investigate. The thing that you want to make sure to do is that you take the most serious things first, which is the case investigation, right? This is the initial encounter with someone who had tested positive. You want to get that out of the way. You want to make sure you get those people in the system and get their contacts as soon as possible. Then you want to contact intake. It's the initial investigation of the contact, or contacting those people that need to be notified that they've been in an area with someone who has been tested positive. And now we're going to the monitoring. The monitoring is we're going to daily keep track, right? The case gets 10 days and the contacts monitoring gets 14 days. So those are the two things that we really want to monitor between the case and the contact. That is a picture of that is a mixture of some of the Bronx engagement specialists. We were out canvassing Fresh Meadows in Queens, which was a neighborhood where there was a significant uptick of coronavirus. So we was out there trying to make sure that the whole neighborhood knows about what's taking place and how to get tested. And as you can see, I'm the guy with the cane and the notepad, and I was keeping count. All right, so standard operating procedures. This is what we did. Well, you have to learn this when you're going through the contact training for the Johns Hopkins on Corsica, right? So the procedural step number one, which I think is the most important step of all steps. If you cannot connect with these people, because it's really a battle between willingness and wariness. Some people are willing and some people are, right? So you have to make sure you make that connection. And one of the things I think that I'm able to connect is that I've had it. I've had COVID, and I'm able to say, listen, we can. I'd like to introduce myself. My name is Jeffrey Omar Patrick. I'm calling from New York City Health and Hospitals, and I would like to discuss with you a very important healthcare matter. And this is something that I've actually been through myself. So just give us a chance to make sure that we can make you get on the right road to recovery. And there's no robotic. You can't. They do give us a script. But I tossed the script. Not because I just figured I want to make as personal connection as I possibly can with everyone I come in contact with. As a matter of fact, I was on the phone with a lady the other day for a half an hour. That's a long time. And I don't mean a half an hour, just we were talking about life, and she was talking about her grandkid and moving to Florida. And I really took the time to listen to her and make sure that she, got what she needed to get off her chest. Okay, the next step is inquiry. We want to find that infectious period. That infectious period is what we really want to make sure we pin down. We want to connect the dots and completing the survey. They give us a survey, and we want to make sure we find all contacts, and we want to make sure that we know exactly what that person was doing 2 days prior to what was before the symptoms started to show. And then we want to identify the contacts, right? We want to know who's who, and we're not going to leave no stones unturned. We're going to take it one step at a time, and we're going to make sure we get through. The servicing, we're going to make sure, at this point, the file is pretty much complete. All that is needed, for isolation or quarantine, we give the directions and we give the support and make sure that they get the wraparound. And then we're going to start contact tracing. We're going to be going after the contacts. We're going to making sure that we reach everyone that needs to be reached and let them know that this is what's taking place and how have you been dealing with it and where we go from here. Then, of course, we're going to make sure we keep track, right? We're going to check in daily. You know what I tell the people who are being monitored? I say call before we call. Because once you call, right, if you get up and you call, then everything is okay instead of having us chase you down. Because sometimes we have to go out there when we're trying to monitor, but we can't get you on the phone, or we're texting you and you're not answering back. So community engagement specialist has to go out. They have to go out and they have to make that trip, right? So there you have it. Those are the 6 eyes of investigation for COVID-19, which is, and there should be a 7th eye, which is independency. You get that from dealing with the contact tracing and having us make a connection. Now the COVID-19 measures. Okay, so these are the cases in New York City since we've had that uproar, right? And positivity, the tracing started in June. I was hired before June, but my start date was really June 6th. And the positivity was at 3.3%. And once it goes to 3 and above, they want to close everything down. They want to go to lockdown pretty much. And, you know, they start talking about school closing and everything. But in September, it was at 1%, right? And the COVID measures, New York City, these numbers are the numbers I took at 2:30 today before we got on this call. I went to go check the numbers. So 7,790 cases. It's up from 5,638. It's increasing. Hospitalization, 380. It's up, 372. Deaths are decreasing, which is something I really appreciate, because one of the things, I think we know a lot more than what we did back in March and April. And so we're actually, you know, things are looking better, but the percentage of people who test positive is still increasing. It's at 2.4%. And I want you to take a look over the last 3 months, how it's been going. The red line, pay attention to it. It's going the right, but it's going in the opposite way. I wish it was going down instead of going up. And that is the date of the cases. 3 months, hospitalization, the red line on an average, right? It's still moving in the not so favorable way. Deaths, you see where everything is it's not leveled off completely, but it looks a lot better than it did back in March. And when I had it in March, listen, I thought I was going to die. It's kind of funny now, right? Because but I was in the room and I was just thinking of all types of crazy things. At one point, I was like, Scooby-Doo, I'm not gonna see Scooby-Doo anymore. Scooby-Dooby-Doo, where I was it was a mess. Things get a little weird when you think you're on your deathbed, but I regress. Let's move forward. Okay. And these are a number of cases, right? Hold on a second. The ages of people who are, and you see the 75 age group is one that's leading the rate per 100,000 people in New York City. And we really have to look out. I definitely have an affinity for the older population, because when I was younger, I grew up in the Bronx, and my mother worked at a nursing home for the elderly, and I worked there and I volunteered there, you know, to help me stay off the streets and do. So I developed a relationship with the elder population, and I think that is one of the most precious population on this planet. Just because you can learn so much and they have so much to tell you, but you know, all right, let's keep it moving here. Okay, so those are the hospitalization, and you see who's still getting hospitalized and who's ahead of the race there. And those are the deaths. Those are the people who are dying the most over the last 3 months. We're looking at a rate of our per 100,000 people. These are male and female. And you see the male is still edging out. And I'm going to tell you what, we were canvassing. I told you we were canvassing in Queens, and I was keeping count. You saw me with my notepad. I was keeping count of everything I thought. I was keeping count of people who were wearing masks, who wasn't wearing masks, who was wearing it improperly, if they were male, if they were female, were there kids. And, you know, women wear their mask more. I'd say it's 2 to 1, maybe a little bit more. But the women were wearing, the men were not wearing their masks. And for some reason, there are some Corona or COVID-19 tough guys. Listen, wear your mask, be considerate, and take care of yourself. It is super important. I can't understand why people don't. And I hear you, you know, and I see people and I hear people, you know, one of the first person I came across when I was canvassing, she said something to me, and it made me so sad that this lady actually said that. She said, you know, there is no proof of a novel coronavirus. And I was like, I didn't know what to say to her. And I was like, people are dying, you know, like that's like the most, I don't know. We just have to make sure we do what we have to do to take care of ourselves and take care of those who are around us and our loved ones. Now, this one, race and ethnicity, right, of cases, hospitalization, and deaths. I want you to take a closer look, if you can. See who's winning the race to death with COVID-19. The Hispanic and Latino category is at full charge. But take a look at the death, right? You see the death? The Black population, African American population, is slightly, even though they're less hospitalized, they're less cases, their death is pretty much right up there. They're dying just as much as any other, any other race. So that is the disparity that we're dealing with. And two things I've noticed. In the Black community, they don't wear masks. In the Jewish community, they don't wear masks. They do not. And I don't know why they thinking that it's okay to walk around without masks. And if they're not wearing masks, trust me, they're not doing anything else, because the mask is the least thing to do. It takes the least effort to wear your mask. Everything else, it takes like a conscious effort. So look at those numbers and just see how disproportionate it really looks when we're all human beings in the same boat. So it's definitely something we should get corrected. And we can't move like dripping ice cream. We can't move in the slow motion. It's an emergency. And whoever doesn't run in an emergency must be different, because an emergency, everyone runs. And that's what this is. At least that's how, nothing has affected my life as much as COVID-19 has affected my life. And I'm seeing it. I'm living it. I'm going through the channels with this. And it is important for us to really take account. Cases, hospitalization, and death in all 5 boroughs. You know what borough I live in? I live in the Bronx, and we are running it. Staten Island is close behind too. A matter of fact, the testing corp had moved some of our specialists out to Staten Island to help with what's going on out there. There's an uptick, serious uptick in Staten Island. And the Bronx is another place. I went into a restaurant to buy lunch for my wife the other day. And when I went into the restaurant, there were people in the restaurant without masks. There were people who, I had to call the manager. I called the manager out and was like, listen, I work for the city, the mayor's office, health and hospitals, and I need for you to make sure that you have people in here wearing masks, because the next time I'm coming in, I'm going to make sure you get fined, because you're not doing what you're supposed to be doing to be protecting the neighborhood and the population at hand. And I really don't want to get like that, but let's be for real here. I'm living it. I'm seeing it. So it is what it is, but okay. Testing. You got to get tested. I have the antibody, right? The antibody's in there, and I get tested once a month. I really should be getting tested more than that. But last month I got tested and it said unknown. I got a little worried, but I figured I had the antibody. Last week I got tested and it came back negative. So, but we have some of the specialists and the people who are more out into the field, the supervisors, specialists, they're in there and they get tested weekly. People who are in hospitals, in the nursing homes, they should get tested weekly. Testing is super important. Again, we want to make sure that we get tested. Now, there are 2 tests, right? You got the polymerase chain reaction test, the PCR test, and then you have the rapid test, the antigen test, right? I found this at the Columbia University Zuckerman Institute, and I thought it was interesting, and I wanted to share it with you guys. And it had to do with infectionness removed and how we can remove it with the testing. So if you're self-isolation, it's a 15% chance you're removing the infection from the population. If you test daily, that's pretty much 100% that, but who has the time to test daily? Although they do have the home test now, that's another thing that the navigation team has. The navigation team has a take-at-home care package that have self-tests. It has masks, it has gloves, and it makes sure that a family has the self-test to take, the proper precautions towards preventing the disease. And 3 days, you see how it's above 80%, whether you're taking the PCR or taking the rapid test. And both of them are through nasal or the throat. The PCR, I think, is through the nasal passage. And weekly, you see how everything goes down quarter day. And one of the reasons, like I said, I have the antibodies, so you don't know how long that's going to last or what it's really going to do for you in the long run. But that's one of the reasons why I only get tests once a month. And I figured, okay, that should help me get through what I need to get through. But I see people who, like this morning, like I said, I had a case investigation. I had to go to a man's house. He tested positive for COVID-19. He had COVID-19. And I had to stand there with him and make sure that he got through the intake process, the right way. And that's where the dedication comes in, because I really want to make sure that this man is all right, his wife that he's living with is all right, and everybody that comes to his residence is okay. That is my main objective. I want people to be okay. I want them to be whole and get them back to the quality of life that they're used to. And if that's not your objective as a tracer, I don't really know how you can contact trace. That's got to be the agenda. All right. Okay. Let's take it through the program, see how we're working, right? How the program's working. Case reached. And if you look where the goal is greater than 90%. And in July, we were hitting boom, 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 boom. Now in November, we're a little bit behind. We're at 89%, but that's how we have to keep on track and make sure that those are the phone calls and those are the visits and those are the way that we make sure that everyone stays in line with this COVID-19, right? All right. Intake completion, 75%. We got to get it. As a matter of fact, my personal intake is about 75. It's like 74 point something. I did it the other day. I wanted to see exactly how much am I getting through and getting people completed. And this, what makes this job really, really important, imperative, is that the people are depending on you, whether they know it or not. Because that's one of the things, like I said, it's willingness, awareness. And that's the thing that you have to make sure that you get, is that they're really depending on you, whether they know it or not. They might not even know it, but we're going to get them through with the intake, and we're going to complete the case, and we're going to make sure that they're okay. Intake completed among all contacts, 75%. The contacts are a little bit tougher, because remember, the contact is like, I'm fine. What are you talking about? Click, and they hang up, right? You go to their house, they're like, no, please leave me alone, because they feel fine. They don't think that they need to complete it because they're not sick. I went to a contact house the other day, and he and I were walking up to the apartment building at the same time. And when I got to his door, he went inside and locked the door and turned off the lights. So you know what that means. He doesn't want to be bothered. And like I said, they need us, whether they know it or not. Here, I think this is a very interesting number. Isolation and quarantine compliance. So people who are saying that they're quarantining and people who are saying that they're staying at home, as you can see, percentage of cases who report having not left their home since the last time they spoke with us. We're at 98%. So that is one of the things that I am so proud of, that we're keeping these people quarantined and we're keeping them isolated, and we're making sure that they're not out there infecting more people. Because let me tell you something, if they're not at home, you know where they are, you know what they're doing, they're infecting people, right? Okay. cumulative progress through the new cases. So this is the latest I have. I think there might be a new one coming out, but as you can see here, the completion of how many people we're putting through among the cumulative cases of the week, and it's progressing and it's increasing daily, monthly, yearly. Hopefully we won't have to do this too long. And I think that's another thing. I think personally, I think contact tracing should be something that's never stopped. I think it's something that we should do at all times. We just got to make sure that we get the funding to keep it up. This is the cumulative progress through new cases. Contacts, I'm sorry. And these are the numbers. The contacts, of course, is going to be higher than the cases because we're making sure we get the non-contacts, we're getting the close contacts, we're getting the contacts to the second degree, and we're getting the proximity contacts. So cumulatively, this is the numbers that we're looking at, right? 85% of all contacts were reached for a live conversation. And I'm telling you, if I don't get you on the phone, I'm coming to your house. See, my schedule is I work from 8 in the morning till 7 at night. So I'm going to be there within those time for some reason. I got 10 hours, and if I don't get you on the phone, I will be knocking your door. And that's not a mistake. And this is the navigator referrals. I refer people to the navigation team at all times. So you can see that well, this is the hotel, the check-ins. They've checked in 491 people into hotels. But remember, they help with medicine, they help with food, they help with mental health care, they help with the phones. And a matter of fact, I have 2 phones to give out right now. They gave me 2 phones to give out. So if I come in contact with someone who needs a phone, I can actually distribute a phone on the spot. Okay. Safety is always first. That is the most redundant thing in this whole practice. It's everywhere. A matter of fact, when I was taking the environmental class with Dr. Shagarjian, safety was always coming up. Always coming up. You have to be safe. You have to be safe. And the CDC has, they don't call it the circle of vigilancy. This is the name I've given it. And they just call it the safety staying safe. But you have to be vigilant. And these are the steps to stay vigilant. And I wouldn't waver these in any way, right? You're going to wash your hands often. That one's given. You're going to avoid close contact. That's very, very important. We're going to cover our mouth and nose when around others. Cover coughs and sneeze at step 4. Step 5, we're going to clean and disinfect. That's very important, especially for me. I'm out there and like my car has so many wipes and so many hand sanitizer and so many disinfectant, and you got to be safe. And you got to be safe, and you don't want anyone to get sick, right? And step 6, you got to monitor your health, right? I got a thermometer. A matter of fact, the Test and Trace Corp provides you with the thermometer, and we get to take our temperature. I take my temperature every morning and every night before I go to bed, just to make sure that it's okay. I mean, I don't feel, but you'd like to see the numbers. If he's at 99, you're like, wait a minute, how did I get warm? Take some aspirin, get that temperature down. Make sure that you're on the right road, right? All right. All right, so we're coming to the close. And I want to just share something with you. Dr. Norm is the director and the head of the Test and Trace, and he shared this poem, and I thought it was very, very interesting, and it got right to the root of what we're doing from the engagement point of the Test and Trace Corp. It says, we probe, we pace, but never face to face. Our skins get tougher as we contact trace. The question we ask are personal yet clear. We reassure our cases in the face of fear, offering hotel rooms, food, or support by phone. We try to help those who feel alone. Sometimes our voices are the only voices they hear all day. We truly listen and talk to make them feel okay. Our language lines are open to help break down barriers. COVID-19 knows not from culture, color, or race. We could all be carriers. We love our jobs and yet hope that sometime soon pain and suffering be alleviated, an end to this doom. In the meantime, our headsets are on and our Salesforce set to online as we contact and trace each case, helping one life at a time. Very, 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 very wonderful. Excuse me, getting a little choked up there for a second. Yeah, this is a resource page that I put together. You can find these all at the Test and Trace Corps, but I wanted to let you guys know that the resources are out there for you to make sure that everything is in line with what you're doing with your daily activities and for you and your family to be safe. It's super important. I know I'm getting a little crazy with that super, but and here are my references. Dr. Liberatos, I'm sorry, but I probably made a mistake in there somewhere.
Jeffrey, this was really, really good.
I want to thank you. I want to say live well, stay safe, take care. That's my email at the bottom. And don't forget the core 4. Wash your hands, wear your mask, social and physical distance, and stay at home otherwise.
This is really good. Thank you, Jeffrey. And I thank the audience for being so good at keeping muted. We didn't get any interference. We have a few questions, and then I can open it up here. First of all, I think Dr. Fox mentioned that, and I'd seen it flash on my phone, that New York City schools are closing, I think starting tomorrow for an undetermined time. And, New York City is starting to see an increase, but, even our increase is so low. And the Dakotas, I think they're at 50, 60%. It's just scary at that point. But we had a few questions here. Let me go back and ask them. A person asked, can you comment on the report today? I'm not sure what report that was, that 80% of cases can't be traced.
80% of cases can't be traced?
Yeah.
Yeah, well, the thing is, you want to make sure that the thing that you do is keep everyone in line who has contact with the contact tracers. Now, some people don't have phone. There are some people who are not going to give right information. There are some people who are not going to answer the phone. So this is why, when you're doing the numbers for the contacts, it's going to be lower than anything else.
Yeah. I could also imagine that if you don't get tested and you're sick, obviously you can't do a contact tracing with those particular individuals. Right. So that could be a portion.
Like for me, when I was sick, I didn't go to the hospital. I just my mother made some mix up. My mother's Jamaican, we're Jamaican. My mother, they love mix up things, they mix up something. And my mother-in-law made sure I took it. And, so Yadman really like COVID-19 still. We're not dealing with it.
Okay, another question. You gotta love mothers, huh?
Yeah.
The other question is, a person asked, if you are tested negative, can you also be tested for the antibody?
Well, that would be a waste, right? Because if you test negative, I wouldn't even worry about getting an antibody. But just because you test negative today, that don't mean you're not going to test positive tomorrow or 2 days from now. Okay. So the antibody, they take your blood and they make sure you had the antibody in there. So I wouldn't worry so much about getting the antibody so much if you've never tested positive.
Yeah. Dr.
But
Etienne,
you can do whatever you want. You can do whatever you want. If you want to take the antibody, go ahead and take the antibody.
Dr. Etienne, do you have a comment that you want to make?
Oh no, I'll just say very nicely done. Great work, Jeff, and it was nice to see that presentation. I did send an invitation out to, as some of you know, Jeff is instructor of medicine at the School of Medicine and helps teach the course on multiculturalism in medicine. And given the, the disproportionate impact of COVID-19 on, underserved communities, particularly communities of color, we did invite the students from the class to join in this presentation today. I'm not sure if I didn't look through all the names to see if they're here, but definitely I want to commend Jeff on a job well done. Very informative and nicely presented with great enthusiasm. Nice job.
And this will be posted on the public health website. It's nymc.edu/public health. And then look on the left side, there'll be public health seminars and people can click that. So we've got a couple more questions here, Jeffrey. Someone said, I'm glad NYMC is tracking. NASA and Suffolk are also, are they conducting the same type of testing tracking with the same type of staff who monitors? First of all, are NASA and Suffolk also doing tracking that you're aware of?
I just know Bronx, Brooklyn, Manhattan, Staten Island, and Queens. I don't go outside of those 5 boroughs.
Okay. And how is testing, tracing, monitoring those who travel back to New York? I know, again, the question goes, I know individuals are supposed to test negative prior to traveling, and again, 4 days later. How is that being tracked? I guess if someone lives in Bronx and they go to Nassau County.
Yeah, there's a OOJ out of jurisdiction team.
Okay.
And they monitor all of that activity to make sure that that tracing is kept in line.
Okay.
Right.
Okay, this is a real interesting question. Maybe our historian, medical people might know, but how does the success rate for COVID-19 contact tracing compare to HIV tracing back in the 90s or late 80s and 90s?
Well, I would think that, like I said, contact tracing is something that we should always do. And
it's not new. We've been doing contact tracing for sexually transmitted diseases for decades. So.
Right. So the flu of 1918 didn't really get, dealt with properly until they started doing contact tracing.
Mm-hmm.
So that's the same thing with, with every other disease that comes along, every other infection that comes along.
Yeah.
It's very important. I think contact tracing is one of, in public health, because listen, in public health, right, there are 10 essentials, as Dr. Tahara would pound into my head. Yes, there are 10 essentials, and we want to make sure that we keep in line with those, and we want to make sure that we educate, we inform, and we get people in the right direction.
Right. Yeah. Okay, Andrea Thompson-Harris has raised her hand. Very nice. Andrea, you can unmute yourself, and if you want to ask a question. Or do I have to do it? Okay. Okay, Andrea, we can't hear you. If you do want to ask a question, then just you can unmute yourself and ask. We can open it up if we don't get a huge number of people unmuting. We've got a couple minutes. We've got about 2 minutes left. Are there any questions that people would want to ask?
Where can we get the rapid test kit from?
Okay, so so you can actually go to the Test and Trace website, and and you can navigate from there which way to go. And they also have pop-up clinics. That's how I take my test every month. I just find the pop-up clinic that's close to my house, and I go get the test from there. And
Perfect.
Any other questions?
Yes,
Gary?
me?
Yeah,
Yes.
Gary, go ahead.
Yes, I got a quick question. What do you believe about what you're feeling on the at-home testing that's been coming out?
So the at-home testing, it's better than no testing, right? It's
What
better
does that entail, sir? What does the at-home entail?
It's a swab. It's a swab that you take and you put it in and you mail it back to the lab, and it's free. You don't have to stamp it or anything, and then they'll send your result back in 2 to 3 days.
Oh, okay.
Okay.
Yeah.
Okay, good. Jeffrey, while we're getting more people, there's a bunch of people saying nice job. So no one said bad. So that's good. Pamela, go ahead. You have a question?
Yeah, so Jeffrey, there's been some reports like in the New York Times about price gouging for testing and, people charging exorbitant amounts. And I know my son is in Ohio and the only place he can go is if they have a pop-up testing. If not, then either, the insurance, if you have insurance, it's charged, but he's like just started a new job and has no insurance. And yeah, in the New York Times piece, they were saying people were being charged like $2,000 for a test out of their own pocket. So, in New York, or especially in the areas that you're working, are the tests that are available, are they, government subsidized or is it out of pocket? Because the home tests are like $200.
Okay, so in New York City, the 5 boroughs, there is zero. You do not pay, zero charge. Test and trace is zero. You find a pop-up clinic, you find a pop-up testing site, or you go to your wherever the test and trace is. Test and trace is no money. If you go somewhere else now, it might be something. But test and trace, $0. Okay. It's a free test. And I think everyone should take advantage of it. Right? And if you go to the NYC Health and Hospital Test and Trace, it's an easy navigation. It navigates you and tells you exactly what. Remember those frequency asked questions and resources I had at the end? That's from there, and it's out there for you to find what exactly you're looking for. And one of the things I really love about this job is that I get to meet so many different people. Well, I work in the Bronx, so I get to meet. Mi español es mejor. Hablo español es muy importante ahora. Sí. Yo creo que el idioma del futuro es. But me's a yard man still, me's a yard man still.
Yeah. Okay, do we have any other question? One more question from anybody? And again, as someone is preparing, I just sent a chat message out. Again, all of this will be available at www.nymc.edu/public health, and then look for the public health seminar series, and we'll have it posted there no later than Monday of next week. So any other questions? Andrea, do you have another question?
Yes, I know this is a bit off key. I have my staff here and they're all, they're very conscious about the vaccine that is being talked about, all these, that it's coming about. And there's a lot of rumors about whether or not to take it or not to take it. And people are very afraid. But this is one answer I don't have for them. How can you give us a little insight on it? So the next time they ask me, I can say something positive.
Well, here's something I know. Inoculation is very important. Inoculation, 60% of the population being vaccinated is going to help suppress COVID-19. I don't know the specific of the vaccine, but I'm going to tell you this much. I'm getting vaccinated. My family's getting vaccinated, and we're going to make sure that we stay safe in this day and age. One of the things that really gets me riled up is all this conspiracy theory and all of this, nonsensical talk when they're saying what they're saying, but yet they have no real solution for whatever they're saying. There's no relief. There's no actual, okay, they're saying the vaccine is going to do this and it's going to do that. So what is the second option? What are you saying we should do to make sure that I don't understand. But being the field that I'm in and being in healthcare and making sure that people are all right, vaccination is one of the greatest discovery that medicine knows.
Well, and again, I'm far from being an expert in vaccination, so any of the other scientists could chip in. One of the concerns I have, and I think it's not an issue anymore, is that the vaccination would have become politicized, and that there would be a political influence on whether or not a vaccine would be available. I don't think that's going to happen now. And so I feel a lot more comfortable. But I think even Vice President-elect Harris said, you know, if there was going to be some political influence, she wasn't interested at all. But I think it's better now, and I think the science and the FDA and CDC, I think, are going to have a very rigorous assessment for vaccinations as far as being safe. So I feel a lot better now than perhaps 4 months ago about taking the vaccination.
Yeah, I think we should all get the vaccine.
Hey, Jeffrey, really, thank you very much. This was really good to know about. I mean, New York City is really kind of the leading edge on doing this contact tracing. So this has been great. We really appreciate it. I'm going to stop the recording, I guess, if officially this is over with, but if someone wants to stick around afterwards for a few seconds.
My mom.
Okay. Annette Tucker has or thumbs up. Okay, very good. So anyway, a lot of
Dean Rosenmetz.
So I'm going to stop the recording now. So okay, I'm going to stop it.